Hey, good morning, everyone, and welcome to the show. I'm your host, Vic Senese. We've got a great show for you today. Hey, if you're watching us, be sure to remember you can always check our website to learn more about the show. Best place to go for all of our past episodes. And it's also a link for our audio podcast. Every show comes out in an audio podcast after the show. So be sure to check that out. We've got a great show for you today. We're going to be talking bladder health and how software can come to the rescue. So we're joined by Aneta Dabrowska, an expert in pelvic health solutions who is passionate about helping people take control of their bladder health. With a focus on how digital tools and easy-to-use software can transform patient care, Aneta brings a wealth of knowledge on the future of pelvic health management. She'll be sharing insights into how technology is making bladder health tracking simpler, smarter, and more accessible for patients and providers. So let's welcome Aneta to the show. Good morning.
Hello, everyone. Good morning. And it's actually good afternoon from my side. I'm speaking to you here from Copenhagen, Denmark, Northern Europe. I think with much better weather than compared to some of you I can see in the comments.
Yeah, a lot of rain around the U.S. area anyway. So
That's
yeah,
right.
welcome. So tell us, how did you get involved in bladder health? How did you get involved in this whole thing?
Thank you very much, Vic. And first of all, let me say thank you for inviting me to speak here. I'm really excited about it. How did I get into bladder health? Well, let me start with the fact that I have a master's degree in life sciences, so I have always been very close to healthcare and research in healthcare diagnostics and all of this. I spent my entire professional career working in pharmaceutical industry, and I happened to be one of the patients that have been looking for tools like bladder health, for example. So after going through the journey myself, I've always been very passionate about digital solutions as well. And I thought, why don't I combine my experience together with the passion, together with the pain that I can see that there is a gap in the market, and create something for fellow patients and also for urologists and clinicians, and something that can really make this journey much better for all of us.
Oh, great. Well, let's get right into it. So I'm going to bring you up your slides and take it.
All right. So everyone, thank you so much for joining the show. I'm going to be talking about Bladder Health, which is a mobile app, and as Vic called it here, a software to the rescue, which I strongly believe it is. Let me maybe start with how do I like to think and talk about overactive bladder and urinary incontinence and these types of problems, which is a silent problem of millions. So when I started thinking about this problem and reading a lot of research and thinking about or trying to find out how to tackle it, as a life science academic myself, I read a lot of papers. So I read a lot of papers about the global prevalence of overactive bladder, urinary incontinence, about population-based survey data, the epidemiology of all of this. And what has really shocked me was the numbers. So what shocked me is that, according to research, over 20% of adults globally are affected by overactive bladder. It has also increased from 18.1% in 2005 to 23.9% in 2024. And it's told, or it's being said, to be growing constantly in the future as well. Moreover, 200 million people worldwide struggle with urinary incontinence, and 1 in 4 women above age of 18 will experience episodes of urinary incontinence. Shocking. Because when you speak to your family, you speak to your friends, that's not really something that you would hear around. So you would think that you're maybe very lonely with your problem, but then once you look at the data and look at the numbers, clearly you're not. But that was not the biggest thing that shocked me. The biggest thing that shocked me was these 2 bullet points here, is the fact that patients wait on average above 3 years before they discuss their symptoms with a healthcare provider. And 61% of women with urinary incontinence will never seek any treatment. I read a really nice study about this, and also a survey for why they don't do that or why they wait for such a long time. And without a surprise, the three main problems are the shame. There is a very big stigma to all the patients affected by this problem. There is lack of time, so they don't know which doctor to go to, they don't know who to consult it, etc. But there is also lack of clarity on importance and possibilities. So what we also very often hear from our users is they think, maybe I just go to the bathroom a little bit too often. Maybe that's not something that I should be discussing with the doctor. Maybe that's not something that I can do about it. Maybe it's just how I am. Maybe this is just my nature. And they only seek help when the symptoms actually progress and get worse. So when I was really thinking about it for a very long time on, okay, with all these statistics in mind, so how big the problem is, how much it affects people's quality of life, but at the same time, how hidden it is, I was thinking, what solution could help, or what are the qualities of a solution that would help? And I thought about 5 things. One is discreet. It must be something that they can use in a social setting. It must be something that still allows you to keep your privacy and keep your health information to yourself. It must be easy to use. This is something that people go through a lot of times during the day. So if they are to track, it must be fast and quick and easy. It must treat patient with respect. It's not an easy topic to talk about. It must provide all-in-one support. So once the patient goes through they break the problem with going through the shame and lack of time, etc. Once they actually try a solution, I thought it needs to be an all-in-one thing, all-in-one solution that can help them out, but then also allow for privacy. So something where they can be sure that their data is secure, their information is secure, and they are fully in charge of what goes in there. And that brought me to creating Bladder Health, really. So Bladder Health, in a one sentence, you can say it's a digital bladder diary, but it's not just that. It's supported with personalized insights, statistics, and personalized insights into your patterns, into your triggers, and your progress, but also comes with built-in guided Kegel exercises, and also comes in with built PDF reports for doctor professionals, because we always say you can use Bladder Health and that's going to help you a lot, but you should always consult medical professional. So what Bladder Health does is allows to bring a really good report for the doctor, so they can take a better decisions, take faster diagnosis, and have a more tailored plan. And I'm going to talk a little bit more about it in a couple of slides. So I've got this idea about the app. I also needed it myself. I've done some research. I haven't found any good options out there. I spoke to very live communities in Reddit, in Facebook, and I thought, okay, if I do that, what is the actual power of this symptom management and bladder training? Can this bring actual value? Because again, it's not a cure. It's always just symptom management, but can it actually make a difference in people's life? And what I came up with is that the answer is yes. I also have done my research on that and spoke to a lot of people, a lot of patients, but also medical professionals. And I came up with a number of things that in which the app can actually bring value and the symptom management can value. And number one, listed here, is personal discovery. So identifying times at increased risk of an incontinence episode and activities that trigger incontinence. As you all know, it doesn't come from one reason, whether it's overactive bladder or incontinence. It's not one specific thing that triggers it. So for a lot of people dealing with stress urgencies, for example, identifying the time where there is an increased risk of an event really helps to plan your day, to be aware of your surrounding, of your environment, and the routines that you need to take in order to go through the day without any unpleasant events. Number two is trigger identification. So learning and cutting your irritants. And now when you read studies or when you speak to doctors, there is a whole list of various things that can trigger your symptoms: caffeine, soda, alcohol, juice, stress, and the list really goes on. What a patient thinks when they see this list is, oh my God, now I need to cut all the things that I like, cut all the things that I'm used to, because otherwise this will never go away. But actually, in practice, it's not true. It's very often not all these things that are a trigger for an individual. Very often, it's just one, two, three of them. Some will trigger the flare-ups more. Some will trigger the flare-ups less. So what's very important is to target the right trigger. And the research was done that's shown that if the right trigger is targeted and eliminated from the life, people can even count on 81% of improvement in their symptoms. So what bladder health allows and symptom tracking allows is, rather than blindly eliminate everything from your life, and then very often, unfortunately, people don't stick to it because it's just too much, it allows to track exactly what it is that is a trigger for myself, and then figuring out the way to replace it, or maybe just have a routine around it. Next bullet point is around optimizing hydration and avoiding imbalance while reducing the symptoms. So a lot of people would say that if I have overactive bladder, I should just drink less. And that's not always the case. I mean, it will often help, but it's also important to not go into the other direction. And that's what I sometimes hear, is that people stop drinking enough water, and that basically takes them to another conditions and another health issues. So it's not about drinking too little. It's actually about finding the sweet spot where you drink enough, you keep yourself hydrated, but at the same time, you don't drink too much, and you know what time in a day to drink. So for example, speaking of nocturia, 75% of patients reducing evening fluid intake report measurable nocturia improvement. Now, for some people, it will be cutting water 2 hours before going to bed. For some people, it will be cutting caffeine 6 hours before going to bed. So again, it's something extremely, extremely individual and needs to be taken with a personal approach. So what I hear, sometimes patients are really being lost because on one hand, they need to hydrate, but then on the other hand, they shouldn't drink too much because of bacteria, etc. So they're a little bit lost in the chaos of information and the chaos of all these different things that they need to do. So in the end, they end up literally getting paralyzed and not doing anything, or maybe sticking to a very strict routine for a week, but then unfortunately giving up. Another thing is bladder training. So tracking and extending time between bathroom visits. It's something that takes a while, but has actually been proven to be very successful in improving the symptoms. The study shows that up to 90% of patients report progress when following bladder training programs. If you use what bladder health allows you to do is to track and really see on the statistics on your curve, how many times a day do you go to the bathroom? And then if you extend the time in between, maybe you start with 30 minutes, maybe you start with 1 hour, extend it by 10 minutes, extend it by 15 minutes, try to stay on it for 1, 2, 3 weeks, and then keep extending it further. That's something that at least our users have really said that has been working for them a lot. As long as you take little steps, even 5 minutes holding is already a big step for some individuals in getting a better life quality. Then I go to strengthening pelvic floor muscles. That's also clinically proven to show up to 70% improvement in symptoms after consistent pelvic floor exercises. And I think the consistency here is also the important part. Of course, it's great to go to a pelvic floor therapy, and I would always recommend everyone to do that. Make sure that you know how to do the exercises. Make sure that you know how to do it correctly. Make sure that you also get your pelvic floor muscles checked, check the tension, etc. But it's actually the consistency that is key. So making sure that you do your training, your exercises every day or a couple of days a week. That's also something that I would always recommend to discuss with a healthcare provider or with a pelvic floor therapist. But the consistency is really key here. Patient empowerment. That's for the patients to really have the feeling of having control over their bladder and over what they do. Again, one of the things that I very often hear from the users is that they feel like they're losing the control over their lives. And this control has really stuck with me as well. And I think to allow people to have a clear view and clear data of what is their condition, how it's progressing, how it's changing, that's something that really gives them back this feeling of control and knowing what's happening. And not to mention, of course, there is a lot of different treatments that one can undergo to treat overactive bladder or incontinence. There is medication, there is Botox injections, there is a lot of different things. But similarly to the irritants, everyone answers differently to these treatments. So I have talked to people who are absolutely amazed by Botox injections. I've talked to people who said it didn't do anything. It didn't help at all. I've spoken to people who took medication, which helped at the beginning tremendously, but then they really lost this moment when medication stopped working and they actually, despite taking the medication, their symptoms were getting worse again. So having this clear oversight of what's happening with my body, what's happening with my bladder, how are my symptoms behaving, this is something that gives back this control and gives this empowerment. And most importantly, relating a little bit to this different types and different underlying conditions of the symptoms, it works for all the types and all the underlying conditions. So it's very personal, and it really allows to understanding this specificality that you will never able to get just going to one doctor's appointment and talking overall about your symptoms. So I thought, with this in mind, that's actually a lot of value that we can give to patients. That's actually a lot of things that they can do on their own. Again, I would always recommend everyone to see a healthcare provider. But as I showed you in the previous slides, there is up to 60% of patients who will never do that. So if we can help them with this by at least starting that, at least getting an understanding that, wow, there are things that I can actually do with it, I actually think this will even increase the amount of people who will eventually seek medical help because they have the data to back it up. So now I will speak a little bit more about the app itself and the different functionalities. So the app has been launched a couple of months ago, but I have worked a lot together with users and other patients to actually make it very simple to use for them. So asking questions, how this thing should really look like, what is important, and how do we make it easy? Because again, a couple of things that were extremely important was easiness of the data entry. So people say it must be easy to enter all the events. It must be fast. It must be always in your pocket. So paper diaries, walking around with a paper and pen and trying to remember to put it there, that's not working. If you're using Bladder Health, it immediately tracks the date, time. You can immediately add the volume. It tracks the fluid type. Are you consuming water, coffee, soda? That also then translates into those personalized insights on your triggers. It provides symptom scoring in accordance to patient perception of intensity of urgency scale. So you can score both your urgency, but also how big of an incontinence episode you experienced. There is also a space for personal note, what is something that people really enjoy. They would like to be able to add some of those ad hoc things, maybe something or maybe they were just very excited about something. So there is space for it every time they add an entry. And most importantly, there is no need to carry around the paper diary, and it's very easy to use in social settings. So as much as in social settings, no one will look weirdly into you for using your phone, people may ask questions if you just take out the pen and paper and write something down every time you use a toilet. So easiness of data entry, that was number one requirement from the patients and from the users to make sure that the app has. Number two, full traceability and the insights. So allowing to view a history as a list, but also having this personalized dashboard. The list is very clear and easy to read, and it's also very detailed. So as you can see in the screenshot to the left, there is a full history of all the events that the person has entered, including the volumes, including the types, including the scores, the personal notes. But also for each day, there is a daily summary. So in total, how many times did I use the bathroom? How many times did I feel urgency? How many times did I have incontinence event? What was the score of these in total? So it's something that our users really appreciate as well. And in the screenshot to the right, you can see our personalized insights dashboard. So this is the overall statistics over past period of time where you can see how it's actually changing. Maybe you start new medication. Is it going down? Maybe you cut off the caffeine. Is it going down? That's something very visual and very easy for people to understand. Also, we compare the volumes, the average volumes of fluid intake and fluid output. That's also something that has been requested by the users to be able to make sure that we keep this hydration in balance. So we don't drink too much, but we also don't drink too little. So that's number two. Now, number three is the guided Kegel exercise. So as I said, going to pelvic floor therapy is great and is absolutely recommended. But if you don't have time to do that every day or a couple of days a week, you can use the app to follow guided exercise session. So the sessions are fully guided. The app tells you what you need to do. Do you need to squeeze? Do you need to relax? For how many seconds? It comes with 3 difficulty levels, like beginner, intermediate, and advanced. And also something that has been requested by our users is to ensure the privacy settings and to ensure that the exercises can be done really anywhere. So if you can see in the screenshot in the top right corner, you can actually be guided by sound, by vibration, or you can only see what is on the screen. And that's because some people would like to use it even as a form of, medication, maybe lay down with your eyes closed and just hear the sound where you need to change something. While some of them would like to maybe do it on their way to work, sitting on a bus, and then they don't really want to have any sounds. They just want to see a screen that will tell them and change the color from squeeze to relax. And last but not least, I mentioned the data-driven doctor visits. So our app also allows for accurate reports, which are proven to win over memory and recall bias. If I speak to medical professionals, and perhaps you have experienced it as well, sometimes people, when they decide, after a long time of hesitation, when they decide to go see a doctor, very often they can't really give any specificality about what they're dealing with. They just say, well, I just feel like I go to the bathroom more often than my colleagues, or it happened to me that I had an incontinence episode. But do they really remember how many times, what they had to drink before, what they had to eat before? Did they go through any stressful situation? What time was it? How much they had to drink the night before? This is where the memory falls behind a little bit. And what the doctors also say is that there's sometimes a recall bias. So, and it can actually go both ways. So there are people who will exaggerate their symptoms because that's what psychology does. Sometimes we just say it happened more time than it actually happened. But there are also people who, due to the shame and the stigma, they will actually say, no, it was not that bad. It was maybe just a couple of drops, or maybe it was, just a few times too often. So from the doctor's perspective, whenever they have the interview with the patient, it can also be difficult to say what is the actual situation and how can I provide a good treatment for the patient, and how I can diagnose them accurately, knowing that there is some recall bias. So what you can see here in the screen, to the left side, you can see this history view, which has the export to PDF button at the top. It works very easily. All you need to do is click the button, and then it immediately creates this PDF, which is saved on your phone. And you can right away share the link, send it to your doctor, or send it to your practitioner. To the right, you can see what the doctor actually sees. So not only they see the daily summaries, but also a full bladder diary at the bottom. So you can clearly see which lines were the fluid intake, which lines were fluid output. You can see the scores. You can see all those personal notes. So you get all this additional information. Maybe I was excited. Maybe I was sitting for a long time in a car, or maybe something else happened. But you also have all these summaries of all the days with what were the volumes in total, what was the frequency in total, etc. So during the visit, there is no need to spend time on calculating and analyzing the paper diaries. It's basically done for you. Now, this is going to be the last section of my presentation, really, and this is what do our users say. There is a lot that they say because we try to be, in very close contact with them. But I just wanted to highlight a couple of things that also show a couple of different use cases and the ways that they use the app for. So the first one here that I wanted to bring up is a person who says at the end, I can even drink coffee again with a routine around it. So the story of this woman was that her very strong trigger was caffeine, but she was also a big coffee lover. So to give away coffee was a big issue. She has done that. She went through the process for a couple of weeks of not drinking the coffee, but then she started introducing it back again, but kept the track of her symptoms. So she started introducing in very low volumes. I believe it was a mix of caffeine and decaf coffee at the beginning, and then really creating the routine around it. So she knows exactly that, okay, if I have my morning coffee, 7:30 a.m., I need to still stay at my house for another 30 minutes, use my bathroom, then I can go. So she can still have her coffee, but not worry about, okay, I'm gonna have a surprise or there is a risk of an episode. Now, another case that I wanted to show up here is that it's not just overactive bladder or urinary incontinence patients that use our app. Here is an example of someone who went through prostate removal. He was using our app as he was informed by a medical professional that after the prostate removal, he may struggle, there may be a risk of incontinence. So what he did was he used the app to really monitor precisely what's going on, what's happening. He says, fortunately, everything is under control, so that's great. He doesn't need to use it anymore, but it helped him. It gave him the security and it gave him the understanding or the feeling that he has things under control. And if there is a risk of something, I'm going to know and I'm going to be able to spot it. Another case, kidney transplant patient. We actually have plenty of these. So for kidney transplant patients, it's extremely important to maintain high fluid intake, but also monitor the fluid balance. So a lot of our daily users are actually kidney transplant patients. Now, another case, and this is actually a screenshot from one of the Reddit communities where one user recommended Bladder Health to another user. And here the question was, hey, I'm thinking about trying this medication. I'm not sure about pills, but my doctor says that maybe that should help me. And someone actually recommends to, yes, do that, try the pills, but make sure to track before and after. So you actually know, does it work for me? And what is the actual difference? And then lastly, we also often get contacted by nurses, by medical professionals who learn about our app from their patients. So I just wanted to say it here because I think we have a really big gap for these types of tools. And I think it's extremely important that us nurses and healthcare professionals, but also people who just have the knowledge about this and have access to people who may be struggling with this, I think it's extremely important to share tools like this because it's a relatively small thing. It's a relatively small effort that the patient needs to take that can really make a big difference in their quality of life. And then I also I thought I'll paste here a couple of ratings that we got from people as well, and I especially like the one in the middle that says, "Finally, it's an app that understands what we go through." And I think for me, whenever we develop the app and try and add new features and think about how we can improve it, I think this is my most important thought always, to have the app that actually understands, so that the patients can have a feeling that the app actually understands what they're going through. Yes, and then this is, I believe, my very last slide, just very quickly on how we reach patients. So it's a mobile app that is available to download by everyone directly. But we also try to do our best to encourage nurses and practitioners to recommend Bladder Health to their patients. We also work on white labeling solutions for clinics and practitioners and pelvic floor therapists. So if they want to have a very specific application or version of the application that is very much tailored to their patients, we also offer this type of partnerships, or we would like to be able to support them with this type of solutions. And we also talk with research organizations where we can talk about, how the process of gathering data can be made easy for patients, because that's something that the research organizations are very much struggling as well. And I'm saying here that we are also open to more. I think my biggest mission with this is to just make sure that all these 20% of adults globally are aware that things like this exist, that they are not alone. And there are so many ways for them to really improve the quality of life and avoid those risks by having such simple solutions in their pockets. So all it takes, it's not a little, but it takes consistency, and it takes time to really understanding what is exactly my case and what is exactly happening to me. Yes. And I think that would be it. So thank you very much. And
All right. That was really great. So
yes,
I'm gonna try to
thanks, Vic.
get my other camera on here. Let's see if I can do that. There we go. So this is my iPad. I'm bringing
Yeah.
up the App Store. So I put Bladder Health in, but the one thing I want to show is it is a crowded area of a lot of trackers out
Yes.
there.
Yes.
So how do I find yours?
Yes. So one thing is that you could probably cannot find mine in here because you said you're using an iPad.
Mhm.
Right now, we are available on Android devices only, but the iOS device is coming by end of this year. So very soon. It's very much in development, and we will be launching it very soon. Now, I wanted to give a comment about the crowded space. I agree, there is a crowded space, but I can also say, as someone who myself looked for a solution like this, neither of the, and now I don't want to, of course, it's very personal, but neither of the solutions of the apps that I used, and I used everything that was available in there, nothing really served the purpose, because there were apps that looked very nice, but for example, I couldn't add any of the scores. And it was very important for me to be able to score. Did I feel urgency? Did I not feel urgency? How big was it? So that was one of the problems. There were apps that provided quite a good tracking, but the history view was not really good. You could only see the events one by one, but no daily summaries or no exports that I could clearly show to my doctor. Or if they were heavy in data, they just looked terrible. And again, from a personal point of view, I know that one can say on one hand it doesn't matter, but it actually does. It needs to be nice and easy and simple to use, and not just overwhelming with amount of text and pictures. And so it is a crowded space, but I would say depending on what you need, there are different apps. And what I was trying to do with Bladder Health is to really suffice all these requirements and have
so as somebody who actually suffers the problem, you were looking at all these apps and said, hey, there's something that could be better, and that's what yours was developed.
Exactly.
Now, is there a cost involved if you're downloading the app?
So the app is at the moment fully for free to download it. And people can use it fully for free. The basic functionalities. What is a premium functionalities is the dashboard, and it's the PDF exports. But everything else, so the tracking itself and the history view and the Kegel exercise, are fully for free for use.
Gotcha. And you got to get that iOS out there. A lot of Apple.
Yes, yeah. Fully aware, and
I think it varies different because you're in Europe, and in America, I think Apple's far more prevalent than it is probably across
100%, 100%. And I know it's a big problem, or I mean, I would say it is one of the most requested things that we hear from both the medical professionals, but also the users. And when I speak with urologists as well, some of them say, well, I think it looks great and I recommend it to my patients, but they can't use it. So, but I can just tell you that once we speak here right now, my co-founder is working on the iOS version. So we know that it's very important. And working hard
to get the Android version, you're just going to the Google store. Is that?
Yes, that's right. That's right.
All right, good. Anybody who has any questions for Aneta? Sorry if I messed your name. Aneta, right?
That's right. That's correct. That's correct.
All right. If anybody has any questions, please put them into the comments. I did see a nice comment come in here. Very interesting and informative. Another tool in the toolbox, as one size does not fit all. Thank you.
Thank you, Katie. Appreciate it.
As a group of urology nurses, I can tell you one of the big things we're involved in is, of course, education for patients. You know, it's you find out that as you've been in this business, I've been in it for over 40 years. We always assume people know things that we consider normal, and it's not the truth.
It's not true.
You were talking a little bit about the fluid intake. Yeah. I'm a big guy who likes to do a bladder diary on everybody. But, when you get it and you go through it, you're like, how much water are you drinking? Well, they say we should drink a lot of water, and but not liters and liters and liters. Yeah. I says, you're going to the bathroom too frequently because you're drinking too much.
Exactly. And I think that's also one of the things that, very often is being overlooked. So people focus a lot on the frequency, on the urgency, but they don't look at how much are you drinking. Or, I also spoke with a user who struggled with nocturia. And then we were like, okay, tell me, what exactly is your routine? Let's say 3 hours before going to bed. And they just loved drinking a huge cup of tea right in bed before going to bed. Well, if you drink half a liter of tea that has, caffeine in it, etc., of course you're going to wake up to go to the bathroom at night. You don't need to struggle with overactive bladder to do that. Everyone would do that.
And people don't realize there's more caffeine in tea than there is in
Yes,
coffee. And
that's also a
caffeine
surprise.
is a bladder stimulant.
Yeah,
So
that's also a
you got to,
surprise for many. Exactly. So that's why I think for us there is also a lot of focus on this fluid intake. Definitely drink a lot of water, but it doesn't mean 5 liters a day.
now, does your app actually point that out then? Does it do the kind of calculate out and figure out what could be
It
going on?
calculates it. It calculates it. That's correct. We're also working on having some actual written recommendations based on all the tracking. But what it does right now, it's going to calculate, okay, what's your average water intake over the past, let's say, 7 days, and you can change that as well. So then when you see, okay, now it's actually I drink 5 liters daily on average,
Yeah.
that will be an indication that that's too much.
And one of the comments I had come in here is, how do easy to use software platforms make a difference compared to traditional paper diaries or manual tracking? And I think we kind of touched on that. There's a lot of forms out there, but who evaluates those? You have to
Yeah.
bring them into generally a professional to find that out.
Yeah, exactly. And I can tell you from my own perspective, I went through the pen and paper as well. It's extremely uncomfortable to use, especially if you want to go to work and meet with friends, etc. You need to remember to have it by your side, and it's also not the nicest thing to just take it out and then your colleagues are going to ask, hey, what are you writing in here? So that's first of all. And then second of all, you have this weird piece of paper, you don't know what it means, any of this information. You wait
Mhm.
until your next meeting with your doctor, and then you look at them calculating and analyzing and thinking. It's just stressful experience, in my opinion, and not
Yeah.
convenient at all.
Well, and the other thing is, if I fill a form out for you and give it to you, you won't be able to read it.
Yeah,
My handwriting is terrible. And I might not be able to read it. I look at some of my old chart notes, I can't read them.
yeah,
So, yeah, this eliminates that problem where people can't read it and can't interpret it. I really think that's a great thing. Um, let's see. If you could give one piece of advice to patients hesitant about trying digital bladder health solutions, what would it be? So, somebody out there might be, worried that there's maybe information going out to somebody.
yeah,
We're all concerned about privacy nowadays.
yeah. That's actually a very good point. And I would say there are two pieces of advice. One is really, because you can use Bladder Health, you can use any other app, but I would always recommend to really check what's happening with your data. And all mobile apps should have it written down in your Play Store or App
Mhm.
Store, or you can contact them for information. I can speak for myself. Our data is fully securely hosted, encrypted, and it doesn't go anywhere. And it's also part of our privacy policy. We would never sell the data, show the data, analyze it, or do anything about it. But also when it comes to just trying out, so separate from the data security perspective, if you're worried about trying out, it's like there's what is there to be like what can be the downside? Like just try it. It's
It's
really not
free.
that
So
difficult. It's free, exactly. And a lot of people are hesitant because they're afraid it's going to be a burden to always remember to track it, etc. It can be a burden, or it can feel like a burden in the first day or two or three. After a while, everyone says this is just normal. It's same as after using a bathroom, I wash my hands. It is
mhm.
normal. It's a habit. And then I put the information on my app. That's it. So you stop even thinking about it. It becomes a habit that is a normal thing to do after you use a bathroom or after you consume a drink.
Yeah, yeah. And I think the privacy is key, because as somebody who puts on a podcast, every week, and a lot of stuff is on Facebook, so I'll be talking about a product for incontinence, maybe a diaper or something. Well, I could tell you the next day, Facebook is sending me all these different diapers. I mean, I don't really need them. I'm just talking about it, but I'm getting all this advice for all
Yes,
these different things
yes,
that I.
yeah,
So you
yeah.
you
It's
know
like,
that the privacy can be an issue.
yeah, absolutely. It can absolutely be an issue, but I can at least assure that we take it very seriously here in Bladder Health. I also, as I said at the beginning, I work in pharmaceutical industry, so I work with clinical data, etc.
Mhm.
I always apply the highest standards when it comes to data privacy. which I know that a lot of apps don't do it. And I'm not trying to suggest that there are apps that don't do that, but it's easy to be overlooked, and it's easy to be just,
Yeah.
just assume that nothing's going to happen. So, yeah.
And Fran Foley came in with privacy is key. So I think that's
Absolutely agree.
a
Absolutely
good
agree.
comment to think about. What's the future innovations that you might be thinking about that excite you coming to urology and pelvic health? What do you
Yeah.
think is going to go? What's next for you?
Yeah, I mean, I think, Vic, before we started this call, we talked about the different ways to measure volume, for example.
Yeah.
I think this is a problematic topic for a lot of people to measure the volume, because then you need to maybe carry a cup with yourself or just use some, some other measurement ways. So I think the way we measure the volumes is going to be a new important thing to really try and streamline and make it simple. That would be my guess.
Yeah, because right now, in order to record your volume, you have to urinate into a container that measures
That's
it.
correct. That's correct. Exactly. So I think if we can streamline this, then that's going to be big. And then one thing that we are currently also working on is with the use of artificial intelligence, etc. I think if we can not only provide the dashboards, the analytics, but also recommendations, but not recommendations out of nowhere, just out of ChatGPT, but actually recommendations that are trained on scientific data. So training the models in scientific data, in research papers, etc., and making sure that the patient gets the recommendation based on those. I think that's going to be a big change as well.
And then your software does biofeedback, the Kegel exercises.
That's right.
But really, you're basically going on explaining what it is and hoping the patients are doing it properly. As somebody who's taught a lot of patients how to do Kegels, a lot of people are squeezing the wrong thing. They're squeezing their stomach, not their pelvic floor. So I think that, wireless monitors could be hooked up so somehow that you could detect whether patients are squeezing
That's
the
actually
proper.
great. That's actually a great point, Vic. That's actually a great point. Yeah.
Stick with me. I'll give you all the good ideas.
Yeah, I think so. I think we need like a whole follow-up after this.
Yeah. But these are the things that we see day in, day out that are problems. And, people often don't look at something like doing pelvic floor exercises as a way to tighten up and improve your continence. It absolutely works. Unfortunately, I don't know what it's like in Europe, but in Americas, we're kind of a little lazy. So we don't like doing exercise.
But see, that's the thing. I think what we're also trying to achieve with the app is make it so easy that you can literally lay down on your sofa, watch your Netflix episode, and just do the exercise. You don't even need to look at the app. Just listen to the vibration or listen to the sound. Or if you're commuting to work, if you're on a bus or waiting in a shop trying to get your groceries, just do it as well. So what I'm trying to achieve with this is make it as easy that it's really unreasonable to not do it. If you want it, it's really simple to, or simple. It's made as simple as possible to do it anytime. So you don't.
And I like the idea that you can use it on a vibration mode so that you don't.
Yes.
You can do the exercise. Nobody knows you're doing it.
Exactly.
Yeah. Oh, that's great. Well, it's really been interesting speaking with you. I don't see any other questions coming through, so we must have covered everything thoroughly.
I guess everything was extremely clear.
But so I think the big thing is, do you have a website that you want to put out there that people can go to?
We do have a website. Should I just paste it here in the comments, or should I just?
If you want to throw it in the comments, that would be the easiest way I can put it on.
Fantastic. Then our website is bladderhealth.app, so it's also quite easy to follow.
So that's easy enough for me to throw up there.
Exactly.
Bladderhealth.app. All right. And we have a thank you that just came through.
Thank you, friend, for coming and listening to the show.
And I'm just going to go over here and put a little plug in for next week's show.
In this insightful UroNurse episode, host Vic Senese speaks with Thomas Exler, VP of the bladder extrophy community. They discuss living with bladder extrophy, a rare congenital condition. Thomas shares his journey discussing challenges, triumphs, and the importance of advocacy and community support. This conversation offers insights for patients, caregivers, clinicians, and those interested in urologic conditions. Join us on September 20th at 9 a.m. Central Time to learn more.
All right. So yeah, Tom approached me as a patient who started his own advocacy for a problem that he had, bladder exstrophy, which if you're not in urology, you probably don't know what that is. But he's going to explain it next week, so I won't give anything more away, but I thought it'd be an interesting talk to spend some time with him. Again, pleasure. Glad to have you on the show today. It's really nice.
Thank you for inviting, Vic.
Looking forward to that app coming out in iOS. We do have another thank you coming in here. And with that, we're going to call it a show, and we'll see everybody next week.
So here's to the mornings, the coffee, the monitor glow, to the wisdom he shares and the folks that he knows. Saturday is special when Vic's on the stream with 40 years of knowledge and a head full of dreams.